Okay, we're going to get started now. My name is Martina Luketich. I'm the registered dietitian at Integra Health. And today we're joining because February, I'm not too sure if everyone knows, is Heart Health Month. So today we're going to be discussing eating well for a healthy heart with a focus on cholesterol management strategies and just eating well in order to support or manage your heart health as we, of course, age. That being said, too, I know that this, of course, webinar could offer a Q&A at the very end and everything like that. So if there are questions that you have throughout the webinar and everything like that, feel free to add them in the chat as we get chatting. And then we'll dedicate around 10 minutes at the very end to go over the questions that have accumulated. Just to kind of give you a little bit of an overview as to what we're going to be discussing for today, I'm going to start by talking about what working with a dietitian really may look like and just a little bit about me and my background. I think a lot of people get scared by working with a dietitian. So I do really want to make sure that you understand what exactly that might look like. We're definitely not the food police. We will not judge you, and we can definitely help you work towards your nutrition goals and your overall health goals by starting small and sustainable goals that end up towards a better picture of your health. We're going to go into a little bit more of a deep dive with healthy cholesterol and healthy cholesterol levels. We're going to go into what high cholesterol looks like and what is high cholesterol if you have been recently diagnosed with this, or potentially if you have it in your family medical history. We definitely want to make sure that we are keeping heart health in mind as we age, no matter what age we are, really. So that being said, too, we're going to do a little bit of a deep dive to help you better understand what nutrition and lifestyle can do in order to make sure that we are keeping heart health in check. I always, of course, even when working with clients, will go over the three pillars of heart health and the three things to keep in mind as you navigate food choices. So we're going to be discussing that. And then really just making sure that we're finding application strategies in order to define what healthy eating for heart health looks like and how to apply these strategies into day-to-day life. We definitely want you to walk away with knowing what to do, but also how to be applying these strategies into a busy lifestyle that we all live. And then, like I mentioned, we're going to wrap up with a Q&A, so you're able to kind of course, get your questions answered. This is just a little bit about me. Like I mentioned, my name is Martina. I'm the registered dietitian at Integra Health. I really specialize in non-nutrition or non-diet nutrition advice, which sounds very weird, but realistically, what that really means is really stepping away from that all or nothing mentality when it comes to food and focusing on, again, really gentle strategies that we can bridge into our day to day that help us feel a little bit more in line with our health goals. I do a lot of intuitive eating and mindful eating in my practice, as well as focusing on chronic disease prevention or management. So maybe this is knowing that we have, higher cholesterol or heart disease in the family line, or maybe we've just recently been diagnosed with high cholesterol. This would be something that we specialize in and can really help you make nutrition informed decisions in order to prevent or manage these things down the line. I also work with a variety of athletes. So sports nutrition, athletic performance, no matter what sport it is, nutrition obviously plays a really, really large aspect in an athlete's, lifestyle. So we really, of course, work with sports as well, really, really closely. My background is from Toronto Metropolitan University. I did my Bachelor's of Applied Science in Nutrition and Food, and then went into, of course, my master's degree in Nutrition Communication, which, of course, lends itself to becoming a registered dietitian. And this is what working with a dietitian looks like. Like I mentioned, it's definitely not something that, we come in and judging your lifestyle or really nitpicking, exactly what we eat. We're all human. We, of course, want to have a very flexible diet. And, we really, really, make sure that we are empathetic and build rapport and everything like that as well. So it's not a scary experience as some people may think. We start off with a comprehensive assessment. So really understanding the nutrition goals that you uniquely have and your medical history, your lifestyle, your current habits, current routines, all of those things that are really kind of course, quintessential and unique to you so that we can, of course, make sure that we're building in strategies that fit your lifestyle specifically. With that first assessment, we really kind of work together to create a custom nutrition plan. This isn't a meal plan per se, but this is really just, of course, to make sure that we're outlining your nutrition journey and what topics need to be covered, what strategies need to be built in, and what we deem as areas of opportunity for you in order to reach your goals. After that, it really is a series of follow up appointments so that we can focus on education and goal setting. So you're walking away with each appointment, understanding exactly what to do, knowing what to do, and trying to kind of course, wrap these into one or two really specific goals that you're able to apply into your own life between appointments. And then, of course, ongoing monitoring. Perfect. So now just to get into the nitty-gritty as well. So we really want to understand cholesterol for ultimate heart health. And I will say majority of my practice really keeps heart health in mind. I do get a lot of referrals from our doctors and everything like that as well with regards to cholesterol levels. And there's always, of course, underlying family history that a lot of my clients are getting a little bit more fearful of, right? And that being said, we of course absolutely have nutrition and lifestyle to use as prevention or management tools. But it's not as scary and it's not as difficult as people may think. So we'll go through those strategies together and, undercover kind of those things that may change, how we look at food or what we can add into our day-to-day lifestyle. So first off, what is blood cholesterol? So to put it really simply, cholesterol is a type of fat that is found within the blood. So it's naturally made by our body. Like we, of course, as healthy individuals, will have a certain level of cholesterol found within our body, but it is increased through lifestyle and diet. And that excessive increase of cholesterol can lead to other things. Just next slide, Rachel. Perfect. Um, if you are kind of thinking a little bit more closely about your cholesterol levels, there are certain individuals that might be more at risk for developing high cholesterol. That could be someone that has an individual family history with heart disease or stroke or anything of that sort, and is existing diagnosis of diabetes or high blood pressure, or even, of course, lifestyle, of course, things involving smoking or, have smoked within the last year. So lifestyle and diet play a big, big role when it comes to heart health and really making sure that we're able to prevent or manage these things down the line as well with simple strategies. The only thing to keep in mind, though, and this is what we really, really encourage, is taking a preventive and proactive lens. The only way to really know if you have high cholesterol is to get a blood test with your doctor. So regular check-ins with a GP, a walk-in doctor, or anything like that as well, too, just to see where you are at, especially if you kind of are coming from that category of being a little bit more at risk for high cholesterol levels, is really important to know, especially if you want to kind of course, take a proactive and preventative lens with your health. So there's two types of cholesterol, and I think when we think cholesterol, we automatically think about the bad kind. There's actually a healthy balance between a good cholesterol levels and bad cholesterol levels within our body. HDL cholesterol is something that you might see on your lab report. That's actually our good cholesterol levels. And these are really, really great and preventative and protective for our heart because it actually aids in removing excess cholesterol from the body. LDL, rather, is our bad cholesterol. And that's the one that I think gets a lot of attention, and rightfully so. This contributes to that plaque along the artery walls that block blood flow in the heart to the heart to the brain. So that's what we really want to monitor. And if you have heard before that you have high cholesterol levels, usually it is coming from that not so nice bad LDL cholesterol that we do want to kind of limit and reduce over time with proper lifestyle strategies. So I'll give a little bit of a trick question. Feel free to kind of course, think about your answer, and or even if you wanted to put in the chat, that's perfectly okay. Do eggs increase blood cholesterol levels? And I get this question a lot in practice of, should I be eating eggs? Should I be having, how many should I be having a week? People do get a lot of fear around eggs because of the cholesterol levels. So maybe I'll just give it 1 second. What do we think? If we want to put it in the chat, feel free. Okay, maybe next slide just to reveal the answer. So the answer is not necessarily. So it's a little bit of a trick question, and we'll delve into why. Um, it's definitely a hot topic that comes up with conversations with clients one-on-one. So when we think about cholesterol levels that we see in food products or just general foods like eggs, Dietary cholesterol that's found in these products or in foods like meat, poultry, eggs, dairy products, all these things actually have a lesser impact on blood cholesterol than foods that are higher in saturated and trans fats. So, when we are reading a label, I, of course, can recall countless times when a client has come to me and said, maybe I shouldn't be having this product because the cholesterol is so high with it. Or it's, of course, nearing that 15% on the percent daily value. When realistically, it's a really great food that someone could be very well having in moderation in their diet. I would, of course, point to more looking at the saturated fats and the trans fat within that product rather than paying so close attention to the cholesterol levels that are found in the dietary cholesterol that is found within that product. When we are, of course, seeing foods that are higher in saturated fats and trans fats, that would have more of a direct association and can cause your LDL, your bad cholesterol, to increase. So when we think about foods containing saturated fats, that could very well look like processed meats, higher fat cuts of meats. So let's say red meats in particular, full fat milk products. So let's say your creams, full fat yogurts, things like that as well. And your solid at room temperature oils. So your butter, lard, coconut oils, all of those good things. And then, of course, trans fats, which I will be honest in saying, of course, thank you to Health Canada. We don't have to be worried about these as much as we once used to be. But this is really found in a lot of partially hydrogenated margarines, deep fried, ultra processed foods, and things like that. And if we go to the next slide, we can really see what kind of course, these saturated fats and these trans fats can, of course, change within our labs. And then again, this is one of those things that, a saturated fat can, of course, increase that LDL, but that trans fat, on the other hand, kind of has a little bit more of a double whammy effect is what we call it, right? So it could really increase that LDL level, but it does have that potential to decrease the protective good cholesterol levels as well. And this is why, of course, Health Canada has really done its job to limit these things in our everyday products as best as they possibly can, which is a great thing to know. So label reading is a really great thing on that kind of course, to its lens, right? So when we think about label reading and you're looking at a product and you're thinking, okay, well, is this, of course, good for my heart health? Is this something that I should be having moderation? Is this something I really shouldn't be having whatsoever? This is a really great tool to think about. And I'm not too sure if a lot of people do pay attention to the percent daily values on their label, but they can really be a great telltale sign if a product is higher or lower or in the middle of saturated fats or fibers or anything like that that we also want to kind of pay attention to. So when we think about your percent daily value, I almost think about it as like a dial per se. If you see a percent daily value that is less than 5, then that means that there's not so much of that in that product per serving of that product. If it means that it's more than 15%, that means there's a lot. So in the perspective of saturated fats, right? If we see that closer to that 15 or beyond that 15% per serving size, then that could kind of send our alarm bells in our brain to think, okay, maybe this is a once in a blue moon product. Maybe this is something I need to be having in moderation or really, really limit depending on, of course, what your goals are. Even other things too, like, of course, like I mentioned, fiber, which we'll get into, is going to be a really great tool to help with lowering cholesterol levels. That said, though, fibers, of course, are a really great thing that we want more of, right? So that would be something on that label that I would maybe want to have closer to 15%. And perfect. This is the, of course, slide that really kind of dedicates itself to things that we want a little bit less of and things that we want a little bit more of. So less total fats, less sodium, really, of course, to make sure that we are paying attention to blood pressure and everything like that as well, and less added sugars and everything like that as well too, so that we're kind of minimizing the excess sugars that we're having in our diet as well. But things that we want more of, yes, fiber. And fiber, of course, can be a really great thing to help with adding into your diet in order to make sure that you're maintaining or, of course, bettering your cholesterol levels over time. So this is just a little bit of an exercise for us to kind of go through, and this is comparing a couple products across the board. So this is not to say that red meat doesn't deserve a place in diet. It definitely should, of course, be focused more towards, though, leaner proteins, because these things will have less saturated fats. And we'll investigate this in a much, of course, deeper degree here. So what we have here is lean ground beef, right? So a typical thing that we might pick up at the grocery store, a very typical product that we use in multiple different dishes, and even getting more hype on social media as well too nowadays, I see. If we do look at the nutrition facts table, there could be a couple things to point out when we are looking at this together. And maybe just go to the next slide so that we can kind of go through everything. So when we look at that percent daily value, this is for around 3 ounces. So probably around a quarter-ish of this package, something along this. So that would be, of course, a regular serving size of a beef or something like that. We see that with a lean ground beef. So even when we see lean, our mind is like, okay, maybe this is going to be a little bit better. We see that this is now above 15% for this specific serving size, which tells us, okay, maybe of course this is going to be a little bit more higher in those saturated fats. And of course it is, right? So when we see 6 grams of saturated fat, that's telling us now, if we do a little bit of mental math, that around 40% of fat from this serving is coming from specifically saturated fats. Okay. So then, of course, that kind of tells us, okay, maybe this is something that we should be having a little bit more in moderation. Next slide. Same product, different kind of fat content. So when you are grocery shopping, another thing that could be a really great game changer is going towards an extra lean ground beef. So like you could see there, bigger difference towards, of course, better saturated fat levels. If you just go to the next slide to reveal, of course, the full math with this. So 6 grams less of fat per serving. So just under 15%. Still is a little bit higher, yes, but a big, big difference, and maybe around a 50% difference compared to the lean ground beef. So we're only coming in at 3.5 grams of saturated fat per serving now, which is great. And there, of course, is a decrease in dietary cholesterol, but it's minimal, right? So it does, of course, go to show that, saturated fats is a little bit more of that telltale sign, or that thing that our eyes should be going towards first, versus that cholesterol level that we see in, of course, the nutrition facts label. So the 3 pillars of heart health. And now that we've discussed, saturated fats and things like that, as well as things that we want to be a little bit more minimal with or limit in our diet, we also want to keep a perspective of what can I add in, right? Because when we kind of think about a goal that we want to set in an appointment, or, a goal that you have in your day-to-day life, thinking about a goal from a glass half empty kind of lens, as much as we know these things that we want to limit, might not be the most effective for us to kind of course, make that dedicated change to our day to day. So just those 3 pillars of heart health, if you go to the next slide, will really be maintaining or minimizing our saturated fat intake to the best of our abilities, but we could still have a little bit, right? We want to increase our healthy fats, so increase our unsaturated fats, what we call them. And then the next one would be increasing your soluble fiber intake, which I think is the number one thing that someone can be really, really doing in order to benefiting their own, heart health and maintaining or preventing chronic disease down the line. Fiber is definitely a gap that a lot of Canadians deal with, and we should be increasing our fiber intake. But when we think about it from a heart health perspective, it's specifically those soluble fibers that we want to, of course, increase. And we'll get into why in just a second. So just to go over saturated fats like we just did, I'll keep it very, very simple here. We really want to kind of course, be mindful of where these things are really kind of coming in from, right? So higher fat cuts of meat like we just saw. So red meats like steak, ground beef, pork, sausages, things like that. Full fat dairy products. So let's say if we are purchasing a 5% Greek yogurt. Greek yogurt is a great source of protein, calcium, all of these things. But if we're purchasing these things at a higher milk fat percentage, then this could contribute to more saturated fats in our day-to-day lifestyle. Same thing goes for cheeses, right? So if we think about a typical milk that is around 0 or 2%, cheeses are around 20% milk fat, and therefore have an increased, of course, content of saturated fats. This isn't to say that we cannot have cheese or anything like that. I think that, of course, wouldn't be the greatest advice to give here, but it does go to show that we should be a little bit more minimal with how much we're using, or we should be watchful of our serving size or portion size of these things when we're adding them to our meals and snacks. Our fats and oils can be a really great source or increased source of saturated fats. And I think a good rule of thumb to kind of keep in mind when you're cooking, grocery shopping, all these things is things that are solid at room temperature will have higher saturated fat contents. So let's say your butters, hard margarines, lard, coconut oils, ghees, palm oils, even coconut oil. I know a couple of years back got a lot of media attention for being a really great oil that we should be using more of. But really, the research did show that, again, it is going to be higher in those saturated fats. So keeping a minimal, of course, approach with those would be the best course of action. Probably comes to no surprise that our highly processed foods, like our takeout, restaurant foods, the things that we're ordering or grabbing on the go, those prepared foods will likely, of course, be a little bit more high in, again, those saturated fats. And then snack foods, chocolate, all those things, which again, I don't think that kind of course, lends itself to taking those things away, of course, having an all or nothing mindset when it comes to them. But it maybe, of course, will give us a little bit more perspective to maybe minimize these things a little bit more in our day to day as well. The important thing to note, though, again, is we always do want flexibility. So, saturated fat, again, we can handle a certain level of saturated fat. It shouldn't be an issue if we're eating a balanced diet that, again, has fewer processed foods in appropriate portion sizes. Our body can tolerate a certain level. It's that excess that we want to be mindful of, as that could contribute to the higher LDL and higher total cholesterol down the line. Unsaturated fats. So the goal here now is to think, okay, can I be, choosing more unsaturated fats as part of snacks, meals, things like that, to again make sure that, we are even, protecting our HDL cholesterol. And that, of course, is a really great tool to manage and make sure that that number is staying in a protective field. So, what their role is that research can really kind of show that monounsaturated fats may actually help with lowering LDL cholesterol while raising that highly protective HDL cholesterol, which we want. So, a moderate intake of healthy unsaturated fats can actually really improve a lot of course, facets in our health. It could aid with nutrient absorption. It could also help with healthy blood cholesterol levels, blood sugar levels, and of course, maintaining, proper energy balance throughout the day. So there's a lot of really great things that adding in more fats from, of course, better sources can be really, really, helpful and important. So these are really found in other types of oils, olive oil, canola oil, even, which I know is a little bit, of course, of a hot topic as well, but it could be really, really great to get in more healthy fats and lower saturated fats, and avocado as well. If you are kind of course, choosing, higher like temperature oils that they can tolerate higher temperatures, all avocado and canola oil are great examples of those. Nuts and nut butter are also a great example of, adding in more soluble fiber or unsaturated fats, as well as avocados. So adding these things in moderate degrees is really, really great in order to benefit a lot of different kind of elements of our labs, specifically making sure that HDL is in a good protective range. Along the categories of fats and those good fats to kind of course, increase in our diet is omega 3s. We do want to choose these more often because they could be, of course, a really great protective tool for our heart health as well. And to be honest, they are a little bit more of a bigger gap in our kind of diet as well. There's not so many foods that are rich in omega 3s, so we do have to be quite intentional with how we have them or how often we have them. Or if I'm honest, I would kind of course, consult a dietitian or your doctor with regards to seeing if you need a supplement if you aren't having these foods in adequate quantities or portion sizes. So, what their role really is when it comes to heart health and cholesterol management is it could actually help reduce your triglycerides, which is a certain type of fat within the blood. Omega 3s can also help with lowering blood pressure and the risk of blood clots. And it also can, of course, not really have too much of a impact with reducing LDL, unfortunately, but it has that ability and potential ability rather to reduce triglycerides and potentially increase HDL. So that good protective cholesterol as well. Like I mentioned, it's a little bit more seldom to find these things in our day to day life. I'm sure, obviously, salmon is where our mind goes first. So, those red fatty fishes that we should be having around twice a week, which I know is difficult. So, salmon, trout, mackerel, sardines, and herring. Nuts and seeds like walnuts, ground flaxseed, which I'm sure that you'll hear a bunch of times in this next presentation. Chia seeds are really great tools of these things as well. Legumes like soybeans or tofu or even edamame beans. Omega 3 fortified products like eggs. And again, I talk to someone, whether it's myself as a dietitian, your GP, anyone to kind of course, think about if a supplement is warranted, maybe if you don't like fish or don't have it enough in your diet. The key piece here, the one that I love to talk about, if I'm honest, and one that I'm readily talking about in patient appointments, is soluble fibers. Because we really want to think about what can we add into our day to day, fiber is that one thing and that one tool that we can really say safely that the research has shown multiple times over and over again that it reduces our, of course, risk of chronic disease down the line. So if we're increasing our fiber and we're working towards getting enough fiber in our diet, that range of what we should be getting, it ranges between men and women, but it should be really at least 30 grams of fiber per day. Canadians are not getting enough. So this should be really where someone could or should start. So how this really helps from a heart health lens and a cholesterol management lens is that soluble fibers are a type of fiber that can really help with reducing blood cholesterol levels and controlling blood sugar levels as well, if you are paying attention to that within your goals. So what happens here is that soluble fibers can reduce the absorption of cholesterol into the bloodstream, which is exactly what we want. And around 5 to 10 grams of soluble fiber specifically can hopefully help decrease LDL levels. And it can be a really great tool to do so. So, like you see in the picture here, plant-based proteins are a huge source of course, these soluble fibers that we know and love. There are other sources like oatmeal, oat bran, and oat flour. Again, your legumes, peas, lentils, chickpeas, anything like that. Certain fruits like apples, pears, citrus fruits, and certain vegetables like Brussels sprouts and broccoli. The other things that we should also be really adding in from, again, an omega 3 perspective, but also from a soluble fiber perspective as well, is chia seeds and flax seeds. If we can have these things really consistently, those would be really great tools to add, again, unsaturated, great omega 3 fats, but also, of course, those soluble fibers as well. So these are kind of the all stars in my mind. And again, flax seeds and chia seeds right up there. So the reason being is because they kind of course, will have both of those really great things. So those good omega 3s that we want for those healthy fats. And it will also, of course, pack in a great deal of soluble fibers. In that same family is things like Metamucil, psyllium, all of those things that you probably have seen when you're wandering a supplement aisle. So these are really great whole food sources of these things that you can add into oatmeals, yogurt bowls, chia puddings, specifically, honestly, probably a breakfast food. So thinking about it from that part, if you're not having a breakfast, maybe thinking about having a breakfast that includes these types of things. Avocado, a really great option as well too. Again, rich in those monounsaturated fats, but then also packs in a little bit of soluble fiber as well. So adding more of these things in moderation can be really helpful. Hemp hearts are also a great tool to increase your omega 3s. They are also a really great protein source. You do need a lot of them to get a good deal of protein, mind you, but they can really pack it in there and again, increase your protein as well if that's a goal that you have on your own. Oatmeal is a really great tool. Again, very soluble fiber rich, a whole grain, something that definitely can be incorporated into snacks, breakfasts, things like that as well. And chickpeas. I love recommending chickpeas or any plant-based protein for that matter, even if it is alongside a meat dish. Let's say you have a salad with chickpeas in it. You're also, of course, maybe having a little bit of a brown rice or sweet potato as a part of your carb. and then maybe you're having a salmon on the side. So it doesn't have to be, dedicating yourself to one vegetarian dish a week or anything like that, as long as you are adding them in alongside other foods in a way that is worth it and meaningful to you. Okay, so now that we know the what to do, bringing it back to kind of strategies that can be really helpful in the how. So when we think about it, this is kind of the gold standard of how we want to kind of portion our plate. So half a plate of fruits and vegetables, a quarter plate of whole grain carbs, a quarter plate of protein. Now, obviously, this plate can be manipulated depending on someone's individual goal. But that said, this is, of course, where someone would likely start. So when we think about adding in more fiber, this plate is a really great example as to why, this could be something that could reach that goal. When we're having a half plate of vegetables or fruits, again, we're really, of course, promoting that fiber intake. When we're choosing 90% whole grain foods versus white processed carbohydrates, we are again committing to that fiber goal. If we're adding in, you see those probably plant-based proteins, scattered amongst the rest of the protein foods, then again, that contributes to that overall fiber goal. So this plate specifically really, really forces that belief of increasing your fiber can be really, really beneficial in order to make sure that we're managing or preventing chronic diseases, whether it's heart disease, diabetes, anything else down the line. And then, of course, too, lifestyle strategies. So, this is where, working with a dietitian can be really, really helpful in order to see what those areas of opportunity would be for you in order to make sure that you are aligning these strategies into your day to day. So, this could very well look like cooking more meals at home to reduce maybe the amount of salt or solid fats in your favorite recipes, right? So, that's where we can work together to think, okay, if we're usually using butter to cook eggs, could we be using an olive oil or an avocado oil or a canola oil to maybe just switch that up and make a small, sustainable change that didn't really cost any sacrifices? Maybe reserving and picking your spots for eating out or for special occasions. So hopefully, again, we want to kind of course, promote more flexibility in your diet and things like that as well, where eating out is still, of course, a realistic thing for someone to be doing. But again, using kind of course, spots where you're going to be social or even, of course, a special occasion, or, you're going to be dining out with a friend or a family member to kind of, again, use those times to have, of course, something that's going to be a little bit more rich in fats. Maintaining physical activity, again, in a ways that you enjoy. So maybe this is around 150 minutes a week, around 30 minutes a day. That could be kind of, again, activity that increases your heart rate and contributes to that goal that we set in, of course, in terms with heart health. The heart health guidelines really, of course, promote around 150 minutes of vigorous exercise per week. That's something that increases your heart rate. So maybe this is going for a walk on an incline or walking a little bit faster than you're typically used to. Or if this is maybe weight training and things like that as well, maybe that's, of course, getting to a spot where you are increasing your heart rate. So that, of course, will really, really help make sure that we're, of course, thinking about our heart health. Smoking is, of course, a thing that we always discuss, and smoking cessation. I know again is a very big challenge for some folks, but can have really, really great, of course, impact on making sure that you are doing everything and anything to prevent heart disease down the line. What this can be really, really impactful with is actually quitting smoking can increase HDL levels. So we definitely really want to make sure that we are, again, thinking about quitting smoking if you are doing that as well right now, because that could be having tremendous effects on maintaining great HDL levels as well. And then alcohol intake and things like that, again, too, can be, of course, something that contributes to triglyceride levels and higher triglyceride levels in the blood. So, therefore, keeping this to a minimum, or again, picking spots where you're going to be social and things like that, of course, at your own discretion. And then this is just, again, a way to kind of get in touch with us. Again, working with a dietitian could be one of those things that isn't scary as much people think, but definitely one of those experiences that we are being really, really flexible with the client in order to make sure that they're setting small, realistic goals that, of course, lead up to long lasting, bigger change down the line. If maybe, of course, you have been recently diagnosed with higher cholesterol levels or things like that from your GP or from your doctor, or you do have family history of it as well, this could be something to think about as, you maybe, of course, delve into strategies and lifestyle tools to hopefully minimize this and hopefully decrease LDL or cholesterol levels in the bloodstream. So that's something that we can absolutely help with. And again, giving you personalized strategies that go a little bit more deeper beyond today's discussion and help with applying those same tools so you're able to, again, of course, think about how this could be effective in your own specific unique lifestyle. So if you do want to book an appointment or even just a free 15-minute consultation to see if it is worth it for you, you can always, of course, head to our clinic website, so integrahealth.ca. And then, of course, you can find me there. Again, this could be an in-person consultation, a virtual consultation, whatever kind of meets your needs and fits your lifestyle best. And definitely, of course, a good tool in order to reach your health goals as well. But if you do have any questions, feel free to reach out to us or to me specifically via email, Instagram, anything like that as well. I don't see any questions in the chat yet as well too. That said, though, if you do want to kind of pop in some last minute questions into the chat, absolutely here to answer them for the next couple of minutes. If not, we're all good. So thank you for joining.